Have you ever had unexplained joint pain, strange rashes, or crushing fatigue? Yet every time you go to the doctor, they tell you that you don't quite meet the criteria for a specific autoimmune disease? It's not in your head. You might be dealing with undifferentiated connective tissue disease, or UCTD, and today we'll break down what that means and how it's diagnosed and managed. This video is brought to you by Dr. Rezaian, a board-certified specialist in arthritis and rheumatology. Just a quick disclaimer. This video is for educational purposes only and isn't meant to replace medical advice. Always talk to your healthcare provider about your symptoms and lab results. So what is undifferentiated connective tissue disease, often called UCTD? It's a real autoimmune condition where your body's defense system mistakenly targets your own tissues. People with UCTD have symptoms and blood test results that suggest a connective tissue disease, but they don't meet the full criteria for a specific diagnosis like lupus, scleroderma, or Sjogren's syndrome. Now, who gets it? It most commonly affects women between their 20s and 50s. In fact, for every man diagnosed, there are about 9 women. Up to a third of early autoimmune symptoms seen in clinics are later diagnosed as UCTD. Some people eventually develop a defined autoimmune disease, but many don't. Some even get better on their own. Scientists believe UCTD is a kind of early stage or milder form of autoimmune disease. The immune system produces specific antibodies, especially ones called anti-nuclear antibodies. There are also signs of both innate and adaptive immune system imbalance, higher levels of immune signaling chemicals, and a combination of genetic and environmental influences, things like sunlight, infections, or even hormone changes. Symptoms vary, but here's what patients often experience: deep fatigue, low fevers, and feeling generally unwell. Joints and muscles might ache without damage. Skin might be sensitive to sunlight or show a butterfly-shaped rash. Fingers can change color in the cold, and eyes or mouth may feel dry. Serious organ issues like kidney or lung problems usually don't show up early on. Blood tests often reveal positive antibodies, especially anti-nuclear antibodies. Others like anti-Rho or anti-RNP may also be present. Some people have low blood counts or slightly reduced complement levels, but again, major organ damage is rare. Diagnosing UCTD takes time. Doctors look for signs of autoimmune activity that last at least 3 months, but without enough clues to say it's lupus, scleroderma, or something else. That's why UCTD is sometimes called a diagnosis of exclusion. It's also important to rule out other conditions like early lupus, Sjogren's, or viral infections. Drug reactions or fibromyalgia, which can mimic these symptoms, need to be considered too. So how is it treated? It depends on how severe the symptoms are. One of the most common and helpful medications is hydroxychloroquine. It can ease joint pain, fatigue, and rashes, and might even reduce the chance of the disease evolving into something more serious. Low-dose steroids are used when there's inflammation, and other immune-modifying medications can be added if things get more active. Supportive treatments also matter: pain relievers for joint aches, eye drops for dryness, and sun protection to prevent flare-ups. If you're on steroids, keeping your bones healthy with vitamin D is essential. Doctors will want to see you regularly: blood tests, symptom check-ins, and sometimes eye exams for those taking hydroxychloroquine help keep everything on track. The outlook: most people do well. Around 70% stay in this undifferentiated state or even go into remission. About 30% develop a defined autoimmune disease, usually within 5 years. Certain signs, like the presence of more specific antibodies or new organ symptoms, can increase that risk. In the end, undifferentiated connective tissue disease may be uncertain in name, but it's very real in its impact. The key is early recognition, consistent care, and staying proactive about your health. That's how you stay ahead of the curve and protect your well-being. With thoughtful treatment and monitoring, many people with UCTD lead full, active lives. Thanks for watching. If you found this helpful, give us a like and subscribe for more patient-centered insights into autoimmune care. Remember, your symptoms are valid. Your story deserves to be heard. Keep advocating for your health.